It's truly remarkable what goes on inside our bodies every single second. It's a complex and beautiful symphony of signals, messages, instructions. At the heart of this communication network are tiny molecules called peptides. Think of them as the body's text messages. They are short chains of amino acids, the very building blocks of proteins. These peptides travel around telling our cells what to do. They can influence our hunger, control our blood sugar, manage inflammation. It's a fascinating area of science, unlocking new ways to tackle big health challenges. When you eat, your gut releases specific peptides. These signal to your brain that you're full. They also tell your pancreas to release insulin, helping manage the sugar from your food. The system is incredibly elegant, but sometimes these signals become weak or disrupted. This can contribute to conditions like type 2 diabetes, obesity. Scientists have figured out how to create man-made versions of these peptides. These can mimic natural signals or even enhance them, offering powerful new tools for medicine. That's led to an explosion of interest in peptide-based drugs. You've likely heard of them: Ozempic, Mounjaro. Now let's talk about the new kid on the block, Retatrutide. If you thought the results from previous weight loss drugs were impressive, then you might want to sit down for this. Retatrutide is the next generation in this family of peptide therapies. It is currently in clinical trials, but the early results have been nothing short of astonishing. It's being developed by the same pharmaceutical company that brought us Mounjaro, Eli Lilly. They are building on their success and taking the science one step further. It represents a significant evolution in our approach to mimicking the body's natural hormonal signals for weight management. So, what exactly is Retatrutide, and why is it causing such a stir? Well, like its predecessors, it is an injectable medication designed to target the hormone receptors that control appetite and blood sugar, but it has a unique trick up its sleeve. While older drugs targeted one or two pathways, Retatrutide targets three. This triple agonist approach is what makes it so potentially powerful. The idea is that by activating three different hormonal pathways at once, you can create a much stronger and more comprehensive effect on metabolism and weight loss. It's like sending three different text messages to your body's control center, all with the same goal. The potential benefits we are seeing in early studies go beyond just shedding pounds. Researchers are observing dramatic improvements in overall metabolic health. This includes better blood sugar control, lower blood pressure, improved cholesterol levels. One of the most intriguing findings is its effect on fatty liver disease, a condition closely linked to obesity and metabolic syndrome. The promise of Retatrutide is that it could help people achieve a level of weight loss previously only seen with bariatric surgery. Imagine being able to achieve a 20 to 25% reduction in your total body weight through a weekly injection. It points towards a future where managing obesity is far more achievable for millions. To really understand what makes Retatrutide different, we need to look under the bonnet and see how these drugs work. Let's start with Ozempic, which contains the active ingredient semaglutide. Ozempic is what we call a GLP-1 receptor agonist. GLP-1, or glucagon-like peptide 1, is a natural hormone your gut releases after you eat. Ozempic mimics this hormone. It tells your brain you are full, slows down how quickly your stomach empties, prompts your pancreas to release insulin when your blood sugar is high. It's a clever, single-action mechanism that has proven to be very effective for many. Next up is Mounjaro, with the active ingredient tirzepatide. Mounjaro took things a step further. It is a dual agonist. This means it mimics not just one but two different gut hormones. It targets the GLP-1 receptor, just like Ozempic, but it also targets another receptor called GIP, or glucose-dependent insulinotropic polypeptide. GIP also plays a role in insulin release and appetite regulation. By activating both pathways simultaneously, Mounjaro creates a more powerful, synergistic effect. Think of it as two messengers amplifying the signal to your brain and pancreas. This dual action is why Mounjaro generally leads to more significant weight loss than Ozempic alone. And this brings us back to Retatrutide. As I mentioned, it is a triple agonist. It targets the GLP-1 receptor and the GIP receptor, but it adds a third target, the glucagon receptor. This is where things get really interesting. For a long time we thought activating the glucagon receptor might raise blood sugar. However, the science now suggests that, when combined with GLP-1 and GIP action, activating the glucagon receptor can actually increase energy expenditure. In simple terms, it may help your body burn more calories even while at rest. It also seems to help suppress appetite even further. So you can see the evolution here. Single key, Ozempic, two-door key, Mounjaro, master key, Retatrutide. This multi-pronged attack, suppressing appetite, improving insulin sensitivity, potentially increasing energy expenditure, is what makes Retatrutide such a formidable new tool. It's a brilliant example of how scientists are learning to speak our body's hormonal language with increasing fluency and sophistication. When it comes to weight loss, the numbers really do speak for themselves. The clinical trials for these drugs have given us some truly eye-opening data. Let's begin with Ozempic semaglutide. In major clinical trials for weight management, people taking the highest dose typically achieved an average weight loss of around 15% of their total body weight over a period of about 68 weeks. For a person weighing 100 kilograms or about 220 pounds, that's a loss of 15 kilograms, which is about 33 pounds. This was a huge leap forward and set a new standard for medical weight management at the time. Then along came Mounjaro, tirzepatide, with its dual agonist action. The results from its trials were even more impressive. In the SURMOUNT-1 study, participants taking the highest dose of Mounjaro lost, on average, a staggering 22.5% of their body weight over 72 weeks. Let's go back to our 100 kilogram person. That's a loss of 22.5 kilograms, nearly 50 pounds. This level of weight loss started to encroach on the results seen with some forms of bariatric surgery. The dual hormone approach was clearly paying dividends, demonstrating that hitting multiple targets could lead to substantially better outcomes for patients struggling with obesity. Now let's look at the early data for Retatrutide. The Phase 2 clinical trial results published in the New England Journal of Medicine were simply remarkable. After just 48 weeks, a shorter time frame than the other trials, participants on the highest dose of Retatrutide lost an average of 24.2% of their body weight. That's nearly a quarter of their entire body mass. Our 100 kilogram person would be down over 24 kilograms, or about 53 pounds, in less than a year. What's more, the data suggested that the participants had not yet reached a plateau, meaning they might have continued to lose weight if the study had continued. Beyond the sheer amount of weight lost, Retatrutide also showed incredible promise for metabolic health. Many participants saw their blood pressure return to normal levels. There were also dramatic reductions in triglycerides, reductions in LDL, the so-called bad cholesterol. Perhaps most significantly, the trial showed that Retatrutide could substantially reduce liver fat, a key driver of metabolic disease. The results are so profound that some in the field are starting to talk about the potential for normalizing body weight in many individuals with obesity, a concept that seemed almost unthinkable just a few years ago. Of course, no medication is without its potential downsides, and it is crucial that we talk about side effects. For all three of these drugs, Ozempic, Mounjaro, Retatrutide, the side effect profile is quite similar. They all work by influencing the gut. The most commonly reported issues are gastrointestinal. People often experience nausea, especially when starting or increasing dose. Diarrhea, vomiting, constipation, abdominal pain. For most people, these are mild to moderate and lessen over time. To manage them, doctors typically start very low and increase gradually over weeks or months. Start low, go slow, gives the body time to adjust. Be mindful of what and how you eat. Large, fatty meals can make nausea worse. Smaller, more frequent meals help. Staying well hydrated is key. Work with your doctor to find the right pace for long-term success. There are rarer but more serious risks to know about. Pancreatitis, which is inflammation of the pancreas, gallbladder problems, and a potential risk of a type of thyroid tumor called medullary thyroid carcinoma. This thyroid cancer risk has been seen in rodent studies, but the link in humans is not yet clear. Not recommended for people with a personal or family history of that specific thyroid cancer. These are powerful medications needing careful medical supervision. Retatrutide is newest, and long-term safety is still being established in larger Phase 3 trials. Early trial side effects align with Ozempic and Mounjaro. GI issues were the most frequent complaint, and severity seemed dose-dependent. Ongoing research will clarify long-term risks, benefits, and best candidates. Safety must be the top priority as we embrace these exciting new therapies. So who stands to benefit the most from these incredible new treatments? The primary candidates are individuals with a BMI of 30 or higher. Clinical obesity, also intended for people with a BMI of 27 or higher who have at least one weight-related problem. Type 2 diabetes, high blood pressure, high cholesterol. For these individuals, the significant weight loss from drugs like Retatrutide could be life-changing. It's not about cosmetics. It's about reducing the risk of heart attacks, strokes, cancer, and improving quality of life and longevity. These medications represent a paradigm shift. They show obesity is a complex chronic disease, not a failure of willpower. Imagine a future, a patient with severe obesity working with their doctor to achieve a 25% weight loss, reverse their type 2 diabetes, come off their blood pressure medication. This is the future Retatrutide and similar drugs promise. They offer hope to millions trapped in a cycle of weight gain and ill health. But there are still many unanswered questions. One of the biggest, what happens when you stop the drug? Evidence from Ozempic and Mounjaro trials suggests hormonal signals revert to their previous state. Weight often comes back. This implies many may need long-term or lifelong treatment. That raises questions about affordability and accessibility. We also need to learn why individuals respond differently. Why does one person respond brilliantly, while another gets more modest results, or more side effects? Is there a genetic component we can identify? And what about muscle loss? Significant weight loss involves losing some muscle along with fat. We need the best ways to combine these drugs with resistance exercise and adequate protein intake to preserve lean mass. The story of Retatrutide is just beginning. It offers immense promise, but we must proceed with curiosity, caution, and commitment to answering these vital questions for future generations.